Hi everyone, this is Randal Serr. I'm going to use this PowerPoint recording to do a short presentation on health reform. And it's going to focus a little bit more on what happens here in Utah, but it'll work for the nationwide perspective as well. So this presentation was created by an organization called Utah Health Policy Project, which is where I happen to work. It's a non-profit, nonpartisan organization. We like to emphasize that because we're not taking sides necessarily. We're not trying to defend or do anything like that. Simply, we're trying to present the facts so that people understand what health reform is. When you hear people talk about health reform, they use 4 or 5 different terms typically: the Affordable Care Act, ACA, the Patient Protection Affordable Care Act, Obamacare, I think is the word that's most commonly used. All of them are referring to the same thing, and we use them interchangeably all the time. So that's just a little bit of information. So the 3 pillars of health reform. Really, if you want to reform the healthcare system, there's kind of 3 things that have to be focused on. Number 1 is expanding coverage. Number 2, ensuring quality. Number 3, containing costs. It's important to remember that the Affordable Care Act really focused on one thing, and that was expanding coverage, making health insurance accessible to more people. It did some things to ensure quality, it did some things to contain costs, but really the main thing that it accomplished was expanding coverage to more people. The way that works, though, and many of you have heard about the insurance mandate, meaning you have to have health insurance in most cases or you'll be subject to a penalty or a fine, is that there's an open enrollment period. That period right now is 3 months. It used to be 6 months. They might scale it down in the future, but right now it's 3 months. You can sign up from November 1st to the end of January. So you have those 3 months to sign up for health insurance. If they didn't do that, then people would wait till they had an accident, wait till they knew they needed surgery, wait till they had a injury on the ski slope, something like that, to get health insurance, and that would kind of just drive costs out of control. So they have what's called an open enrollment period. If you're outside of that open enrollment period, then the only thing that you can do is wait around, or if you have some sort of big life change, like you get married, you lose your health insurance, you turn 26, any of these things that are listed on this slide here, those would allow you to sign up typically outside of what is the open enrollment period, and they call that a special enrollment period or a qualifying life. So here's some of the basic ways that the Affordable Care Act or the ACA changed healthcare, and I think that the 5 things that they list on this slide are probably the most popular tenets of the law. So starting on the top left side there, adults under the age of 26 can stay on their parents' insurance plan. It didn't used to be that way. A lot of times college students or people that were starting out in their careers were forced to go without health insurance because they didn't have any sort of affordable option. We talked to a lot of you students right now, or students from other universities for that matter, that have really benefited from this. And you can see here from this slide that in 2010, 29% of Utahns aged 18 to 26 went without health insurance, so nearly a third. That's gone down to lower than 18% now in 2013. So that data is a few years old, obviously, but you can see that there was a massive reduction in the uninsured rate in that age group. Top right, there's no lifetime caps on insurance payments. So the way that health insurance used to work is that your health insurance company could decline to pay for a lot of the more expensive services at a certain point. So if somebody, for example, has cancer, they need a lot of treatments, they need a lot of medications, a lot of surgery, a lot of radiation, those sorts of things. It used to be that the insurance companies could stop paying at a certain point. Now, you have health insurance. Most plans offer what's called an out-of-pocket max, where the person that has the health insurance doesn't have to pay anything else after that point besides their monthly premium, and then the health insurance will cover the rest. There's no limit to that. Once you have health insurance, now the health insurance company is required to continue to make those payments. The middle one there, insurance offers free preventative care like blood pressure checks, flu shots, health screenings. They wrote this into the law to encourage people to get preventive care, take care of things early on to prevent them from being becoming more expensive down the road. Bottom left, no one can be denied or priced out of coverage for a pre-existing condition. I think this is probably the most popular tenet of the law. It used to be that when people would apply for health insurance, they'd have you write down your health history, and health insurance companies could choose whether or not to take you on based on your health history. Now, if anybody wants health insurance and they qualify for it, they can get it. Bottom right, men and women pay the same for coverage. It used to be that when you bought health insurance, if you're a woman, you were much more likely to pay more for the same plan as a man would. And they changed that now, so men and women pay the same for the same plan. Something else that they did, they tried to prevent this issue that we really had in Utah and in other states as well, but in Utah it was a big issue where people had insurance, but we had one of the highest rates of underinsurance in the nation, meaning people had health insurance, but it didn't offer a lot of coverage. Now every plan that qualifies under the law has to offer these 10 things listed here, which you don't necessarily need to memorize, but it just gives you an idea of, you know, every health insurance plan now is standardized in what the benefits are that they cover. That doesn't mean the plans don't vary in what they cover, but they have to cover at least these 10 things. So what are the penalties for the people that go without health insurance in 2017? You hear people talk about penalties a lot. And that's a big sticking point, obviously, in elections and so forth. The penalty per adult is $695, half of that per child, or up to $2,085 per household. So there's kind of a maximum there that they would hit. Or 2.5% of your adjusted gross income. That gets a little complicated because it's actually your gross income minus the filing threshold. So suffice it to say, there is a pretty stiff penalty, but you can virtually always find a plan that would be the same as the penalty or less than what you'd be paying for the penalty. So where are we at in Utah? Because of the Affordable Care Act, up to 164,415 people in Utah have what is Obamacare or Affordable Care Act insurance now. So that's not counting Medicaid, that's not counting people getting health insurance through their job, that's strictly through healthcare.gov, that's strictly through the marketplace because of the law. So 164,000 people, that's quite a big number for the size of a state like Utah. So when you go on healthcare.gov, how do they decide which plans to go with? They basically break them up into 5 categories: catastrophic, bronze, silver, gold, and then platinum. And these are all based on actuarial value, which basically means what's the percentage that your health insurance company will cover versus what you will cover as an insured person. The plans, now, if you choose a platinum plan, odds are you're going to pay more month to month, or in premiums, but you'll have a lot lower deductible, lower co-pays, those sorts of things. If you choose a catastrophic plan, you're going to pay less per month, but you'll have higher deductibles, higher co-pays, those sorts of things. So it's kind of like squeezing a balloon. If you squeeze it in one place, it's going to expand in another place, right? So essentially what they're saying is you got to try to figure out, do you use health insurance a lot? Are you likely to go make a lot of doctor's visits? And you should make a choice based on that. Most people, vast majority of people, end up going with a silver plan. So how does the Affordable Care Act affect you? If you're in one of these top 3 light blue bars here, if you work for a large company or a small company or you're a senior citizen, odds are that you're offered health insurance either through your job or through Medicare. That actually accounts for about 85% of people in the United States. So there's not really any changes to their coverage. I mean, they have to qualify for the essential health benefits, but beyond that, not too much has changed in that area. The people that the Affordable Care Act was trying to help were those that could lose their job, people that were working a part-time job or 2 part-time jobs and weren't offered health insurance, people that were self-employed that had little or no health insurance, and then younger people that tended to go uninsured. That's who it was trying to affect and who it was trying to help. And that accounts for 15% of our population. So what is this marketplace that we keep talking about? Here in Utah, we use healthcare.gov. Some states created their own marketplace, but the idea was they wanted to make it easier to shop for health insurance than what it used to be, right? As opposed to going out and applying for health insurance directly through a healthcare company, they put all the plans that were offered in the same place so you could do kind of price comparisons, sort of like you were shopping on Amazon. Now, it's not that simple, obviously, because health insurance isn't that simple, but the idea was they wanted to put all the plans in front of you so that you could do some cost-benefit analysis, and you could know that the plans were decent plans that offered good coverage. After dropping rapidly in 2014 and 2015, the uninsured rate in the United States is actually leveling off a little bit. So you can see that when the law was passed and it was implemented, we had an insured rate in the U.S. of about 18 to 20%. It's now down to about 10 to 12%, which, depending on which study you look at. And that's a huge downward spiral, obviously, in the uninsured rate, but it's starting to level off. We'll talk more about that in a little bit, about why that's happening. Here in Utah, you can see based on 3 different state and national surveys, Utah's uninsured rate is also down to about 10 or 12%. The national average in most cases is a little bit lower than that, so Utah has a little bit higher uninsured rate than some of our neighboring states. But you can see, once again, the uninsured rate has gone way down. One challenge we have in Utah is that we have a high uninsured rate for Hispanic children. In fact, Utah is the worst in the nation. We're ranked 51 out of 51 if you count Washington, D.C., for the percentage of uninsured Hispanic kids that we have in the state. So in Utah, that percentage is nearly 17%. So nearly 1 in 5 of our Hispanic kids go without health insurance. Why is that? Well, what we've noticed over the past 4 or 5 years is that there's 5 or 6 different reasons that are typically given when you ask the Hispanic population about why they decided to go out without health insurance. Number 1, applying for health insurance is viewed as very complicated and burdensome. Number 2, there's language and cultural barriers. Now, some of these barriers are not unique to the Hispanic population, obviously, but these are the barriers that we need to be aware of. Number 3, distrust of DWS. DWS is the Department of Workforce Services here in Utah, and there's a perception that that when you apply for health insurance, there's just not a good relationship between the applicant and those processing the application. Whether or not that's true, that's kind of one of the perceptions. Number 4, education. What we mean by this is that most people don't know what they qualify for, right? They're not sure if they qualify for Medicaid, CHIP, Obamacare, insurance through their job. They're not sure exactly what they're supposed to sign up for. 5, there's policy issues around what makes it easier, what makes it more difficult to sign up for health insurance. And then the last one is stigma, meaning that there's a kind of a pride issue, right? Some people don't want to have Medicaid. They don't want help from the government getting health insurance for them and their families. So if I were to ask you who in Utah or where in Utah are the most people signing up for health insurance through Obamacare, through the Affordable Care Act, typically when we ask this to people, they'll say Salt Lake City, West Valley, kind of those areas. But it turns out that in 2016, 13 of Utah's top 20 zip codes for ACA enrollment were actually outside of Salt Lake. You can see here that the #1 city for health insurance enrollment through Obamacare last year was Lehigh, followed by South Jordan, American Fork, Pleasant Grove, and St. George. But 13 of the 20 zip codes listed here are actually all outside of Salt Lake County. We like to point that out because there's people signing up all across the state. This isn't just a big city benefit, right? This benefits people all across the state, your neighbors, your friends, people you might not think were signing up for it. Over half of Utah's ACA enrollment is under the age of 34. What that means is we have a lot of young people signing up in Utah, and that's one of the reasons that Utah's insured rates, or excuse me, the rates for the cost of health insurance are low. We're one of the lowest cost health insurance states in the nation. 85% of those that sign up through healthcare.gov receive a premium subsidy. What that means is they get help paying for their health insurance month to month. So the vast majority of those that sign up through healthcare.gov get help paying for their health insurance. What will 2017 be? What we've noticed is a trend. As you can see here in 2014 in that first bar on the left, it used to be that when you'd get on healthcare.gov as a Utahn, there were 91 plans that you had to sort through. They've kind of whittled that down over time, and now in 2017, there's only 28 plans to choose from. So plans have figured out which ones are popular, which ones people tend to sign up for, which ones they tend to like, and which ones are also sustainable for the health insurance company. So it's easier now to sort through the plans that are offered. There was a lot of news for a while getting overblown about people not having a lot of options when they signed on through healthcare.gov, that there would only be one health insurance company offered in their county. Turns out that in Utah, 95% of Utahns have access to 2 or more marketplace insurers, 2 or more health insurance companies. So the areas in purple, those are the areas where people only have one health insurer to choose from. But it turns out only about 5% of Utah's population lives in those areas. So if it's a more populated area, you tend to have more options. So this is the one slide that I think most people really enjoy and really start to understand what is the Affordable Care Act, what is Obamacare. So let me explain this. This chart points out who qualifies for help paying for their health insurance under the Affordable Care Act. So you can find yourself up here if you want to, right? You could think about how many people are in your household, right? And then you can figure out what's your yearly income. And if you fall on this chart, in between those two goalposts there, you can see I kind of created a football goalpost there. If you're between the goalposts, you qualify for help paying for your health insurance. So let's walk through a few examples here. So the Hernandez family, they're a family of 4 that makes $26,000 a year. Okay, if we go back to the chart, you would see that a family of 4 making $26,000 a year is between the goalposts. So that means they're just over the goalpost. They're at 109% poverty. If they were to buy health insurance on their own, just for the parents, it would be about $550 a month. But if they go through healthcare.gov, they get $502 of help per month, meaning the parents can get their health insurance for about $48 per month, depending on which plan they choose. In this case, the kids are on Medicaid, so they're covered. So this example means that just the parents, it would only be $48 a month for them. Let's look at a little bit different scenario. So a family of 3 making $44,000 a year, they're also in between those goalposts back on that chart. They're at 220% poverty level, so a little bit higher on the income scale. If they were to buy health insurance for the 2 parents and the child, in this case the child does not qualify for Medicaid or CHIP, the plan per month would cost them $612. But with the help of the Affordable Care Act, it would be $348 subsidy per month, and the Shumways would only pay $263 per month for their health insurance. Now, before I give a next example, what you have to understand about when people talk about whether or not health insurance is expensive or affordable, so much of that is perspective, right? There's people that come through our office that are ecstatic to get a plan where they're paying $400 a month, because what they used to have was upwards of $1,000 a month, right? Somebody doing cancer treatment is ecstatic to get health insurance for a few $100s a month as opposed to what they were paying before. We have other people that come into our office, they qualify for plans that are $2 a month, and they think that's too expensive and they decide to go without health insurance. So, you know, when you hear people talk about affordability and whether or not health insurance is affordable or too expensive, there's so much that goes into that, and a lot of it really is situational. But as you can see on these slides, it really is based on your household size and your income level. So here's another example. The Smiths, they make $42,000 a year. This is a couple approaching the age of Medicare. So their health insurance is going to be more expensive than what it would be for a 30-year-old to get health insurance. If the Smiths were to buy health insurance on their own, it would be $1,544 a month. But with the help of, once again, the Affordable Care Act, it would reduce their monthly premium down to $333 per month. So you're starting to see how this works. But what if you're outside of the goalposts? Let's talk about that. So if you're above the goalpost, right, if you're above the income level to get assistance from the federal government to pay for your health insurance, the assumption, at least when they wrote the law, whether or not this is correct, the assumption was that they could afford to buy health insurance at full cost. Now the Phillips family, this is a different case in which the mother has 3 children. She makes $21,000 a year, meaning she's just below that goalpost. She makes 86% of poverty level, so not quite up to poverty level, right? If she was to buy a plan for herself, it would be $564 a month. She doesn't get subsidies because she's below that goalpost. So it would cost her $564 a month, which for a mother of 3 making $21,000 a year is probably not realistic. In this case, once again, the kids qualify for Medicaid, but the mother is in what they refer to as the Medicaid gap, which I'll explain more at length in just a minute. So, as you can imagine, this gets pretty complicated for some people if they don't understand health insurance. So what are people supposed to do if they don't know what the answers are? They don't know what to sign up for. They don't know where to go to sign up. There was a perfect example of this in the Salt Lake Tribune that came out a couple years ago. in which a mother tried to apply for her and her daughter and really just ended up being frustrated and not knowing what to do and went without health insurance for a while. And she said, "It's irritating because I really tried." What ended up happening with her was when we saw this story, we connected her with what's called a navigator, which is somebody that's trained and licensed to help answer people's questions about their health insurance and help them sign up. Long story short, 2 weeks later after we found the story, both her and her daughter were covered. So there is assistance out there. There are answers out there. A lot of times people just don't know what they qualify for. They don't know where they can go to get help. And that was through a program called Take Care Utah that she helped. So let's go back and talk again about this coverage gap, the Medicaid gap. What happened was, well, let's touch first on who has Medicaid. So in Utah, there's about 400,000 people signed up for Medicaid, most of which are children. But when they wrote the law, when they wrote the Affordable Care Act, they had in mind what was universal health coverage, right? For the vast majority of people, they could get health insurance if they wanted it. So when the law passed in 2010, there were kind of two puzzle pieces to this. The first was Medicaid expansion, meaning that anybody below poverty level would get Medicaid, right? A lot of states don't offer that until this law was passed. So the lower income group would get Medicaid. Anybody on that income chart that we keep referring to would get help paying for their health insurance through the marketplace. Now, once again, this is not, if you have health insurance through your job, if you have Medicare, those kinds of things, this doesn't affect you. But this is for people that didn't have health insurance. What happened was roughly 31 states got together. They sued the federal government. And it ended up going to the Supreme Court. When it got to the Supreme Court, they ruled the law constitutional. They ruled the Affordable Care Act constitutional, but they made that Medicaid expansion piece optional to every state. So when they did that, they broke up the law, right? They took it from being universal to giving a lot of people access, but not everybody. So what that means was every state can now choose whether or not they want to provide Medicaid to those in poverty, mostly adults. So here on this chart, I think this is really important to understand. So I'm going to go from bottom to top. This outlines who in Utah qualifies for Medicaid, right? So if you're a child age 6 to 18 or 0 to 5, you qualify for Medicaid up to 133% of the poverty level. If you are a pregnant woman or somebody above the age of 65 or somebody with a disability, those next three bars, you also qualify for Medicaid, some up to poverty level, some up to 133% poverty level. Where we get into problems is when you're looking at adults with children, they only qualify for Medicaid up to 50% of poverty level. So not poverty level, but half of poverty level. So if you're an adult and you have kids, the only way you qualify for Medicaid is if you're making an extremely low amount of money. If you're making like that last slide I showed a few earlier where the mother would have to pay full cost for her health insurance because she was just below that bar, that means she didn't qualify for Medicaid, nor did she qualify for help through healthcare.gov. And once again, this was the result of the Supreme Court breaking up the law and making Medicaid expansion possible. Now, if you're an adult in Utah without children, just a single adult, no kids, you don't qualify for Medicaid, period, unless you have a disability, unless you're pregnant, unless you're above the age of 65. But if you're just an adult without one of those categories, they call it, then you don't qualify for health insurance in any realistically affordable way. In Utah, that equates to about 63,000 people, and that's a lot of people going without health. Excuse me. So if you're an adult without children, once again, 63,000 people in Utah that don't qualify for affordable health insurance. You can see on this map, all of our neighboring states, or virtually all of our neighboring states, have gone ahead and expanded Medicaid. Utah is one of about 29 states that has decided not to expand Medicaid. And that's a lot of people. 63,000, once again, equates to a lot more across the nation. But that is an issue that we'll explore later at more length in our class, but it's an issue to be aware of nonetheless. That ends the presentation. Thank you very much.